we've seen over the last 4 to 5 years, we've seen a trend towards level funding. And I think reference-based pricing can be one of the things that can move us forward in the level funded process and program. Here's some statements about the economics of healthcare. Healthcare is the only service people consume without knowing the cost in advance. You go into a restaurant, you go into a store. I always seem to use Best Buy as my example to go buy a TV. And if you go to the clerk and you say, I would like to purchase this TV, and they say, great, who do you work for? And they adjust the price according to who you work for. That's, I'd be rather upset about that. I want the same price as everybody else, but with healthcare, that's not the case. You go in and it's one price if you're with Blue Cross, one price if you're with PHCS, another if you're with Cigna, another if you're with Medicare. So what we have is there is no price match guarantee. So private insurers pay nearly double Medicare rates for hospital services, and that ranges from 141% on up to 259% across a number of studies that I looked at. According to the Kaiser Family Foundation, April 15, 2020, the difference between private insurance and Medicare rates is greater for outpatient services at a hospital, 264% versus 189% of Medicare rates. Let's look at an example. Cost of an MRI in San Francisco. Here's the zip code 94016. Cost of it without dye on the back. Health Diagnostics, $575. That sounds reasonable. St. Mary's, $875. NorCal, $1,024. Valley Radiology, $1,378. Drop down to California Pacific Medical Center, $2,607. University of California Medical, what is that, $6,000 plus? What's the average reimbursement by Medicare? $614. Typically, these are all the same machine. It produces the same results. If you go across the United States, Medicare typically pays $464 for the scan. Well, how about this idea? How about we manage care differently? Why don't we find a reference base that we can start at and go from there? What if we started at Medicare pricing? And then we go up from there. We know that Medicare is the rock bottom. Doctors, hospitals all complain, Medicare, 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 how cheap and how tight it is, and that they can't run their practice just by that amount. Well, they still continue to accept those patients. So what if we give them a little more, but not the 264% more? Now we have a known amount. We have set pricing. We have easier administration for the insurance carriers. We can use any provider who's willing to accept that, and there's no change in services. So we're not limiting your services. We are just taking a deeper discount. So we're doing our reference-based pricing here at OptiMed at 150% of Medicare versus a PPO being 200 to 265% of Medicare. So what can we expect? Let's be realistic now in what we can expect. Reference-based pricing system, employers can expect a minimum of 10 to 15% savings. Realistic, conservative. That's what we want to be. We want to under-promise and over-deliver for you. Those savings are largely just changing to reference-based pricing. We can say that much more. The reference-based pricing model flattens year-over-year trend because you are renewing, because Medicare doesn't always raise their rates 10, 15% a year like many physician offices do. Let's address this elephant in the room. The biggest question in everybody's mind is, what about balanced billing? Here's how we're going to deal with balanced billing. 90% plus really of providers are accepting that reference-based price of 150% of Medicare. So when we tell providers we're at 150% of Medicare, they're like, fine, we'll take that. It's some of these other reference-based pricing plans that are trying to trim it even lower, and that's where they're getting a lot of their kickback from. Another 7+% of those providers will accept 150 to 200%. So we do have room to negotiate, and we have agreed with our carrier and our repricing partner so that we do have room to negotiate for that 7+%. Now, there are still some of the 1 to 2% of providers that just say, I am not going to work with you. But what we've done is Optimed, we've partnered with a strategic advisor that has experience, and we have results. And what we're doing is we're trying to limit, and our goal is no balance billing. Our pricing partner is Zelis. They've been in the pricing negotiation with providers for over 20 years. They have over 11 years of providing reference-based pricing solutions in the marketplace. Over 5 million reference-based pricing claims have been repriced. Over 45,000 employees' lives are insured under reference-based pricing programs through Zelis alone. Typical, according to Zelis, is 15 to 25%. So again, I'm promising less than they're promising. We have the words, they're a full integrated partner. They will do the industry leading advocacy. So if we have that 7%, we have that 1%, 2% that are resisting the 150% reimbursement, Zelis will be that patient advocate for your clients so that they do not have to do the negotiation. And typically, they never see it. They never know what's going on behind the scene.